Welcome back to the Medical Entrepreneur IV Chelation Training Series. I'm Adam Sewell, MD, and in this video D3, we're going to talk about how to market your IV chelation service ethically and effectively, and how to educate the right patients to seek your help. No matter how good your clinical protocols are, your service won't grow unless people know about it, trust it, and understand how it can help them. Quick reminder, this video is for educational purposes only. Always make sure your marketing complies with local advertising laws, truth in advertising regulations, and medical board guidelines. Let's get into the strategy. Start with your brand. Branding isn't just a logo, it's what people think and feel when they hear your name. For chelation services, your brand should convey science-backed safety, relief from toxic burden, hope for improvement where conventional approaches have failed. Now build a professional online presence around that message. Website, have a dedicated IV chelation page with clear explanations, pricing, frequently asked questions, and video testimonials if possible. SEO, use keywords like IV chelation therapy, heavy metal detox doctor near me, and EDTA infusion clinic to get found in search. Social media, use Instagram, Facebook, and YouTube to post short educational videos, case studies, before and afters, or behind the scenes infusion room footage. Tip, be consistent, post regularly, and use story-based marketing. Tell real stories about real people with permission and how chelation helped them get their life back. Next, let's talk about community outreach and how to position yourself as the go-to provider for metal-related health concerns. You don't need to convince everyone, just educate the right people. Try these ideas. Workshops and webinars. Host monthly or quarterly educational sessions on topics like hidden symptoms of heavy metal toxicity or lead exposure and brain fog. Collaborate with allied providers. Naturopaths, chiropractors, functional medicine doctors, dentists, and nutritionists often see patients with unexplained symptoms. Teach them what to look for and offer to co-manage. Occupational health outreach. Partner with businesses, unions, or schools where workers might be exposed to metals, like painters, mechanics, factory workers, or agricultural staff. Patient referral cards. Give your current patients simple referral cards or shareable links to send to friends and family. You'll be surprised how many people are quietly suffering. Pro tip, frame chelation not as an alternative therapy, but as a scientific, targeted intervention for a documented medical issue. That builds trust. As the calls and emails start coming in, your team needs to know how to handle patient inquiries in a way that builds confidence while setting realistic expectations. Handling inquiries and setting expectations. Train your front desk. Make sure they can answer basic questions about what chelation is, what conditions it's used for, and the general price range. Use pre-screening tools. Have a short intake form or quiz on your website so people can self-identify whether they're a good candidate. Use plain language. Avoid medical jargon. Explain what symptoms chelation might help with, like fatigue, headaches, brain fog, or joint pain, and how it works in layman's terms. Be honest. Set proper expectations. Chelation is a process. It's not a one-and-done fix. Patients may need several infusions over time, and they may feel worse before they feel better. That's normal with mobilization of stored metals. Bottom line, educate with compassion, answer with clarity, and speak with confidence. To wrap up, 1. Build a strong online presence with clear messaging and educational content. 2. Establish your authority through community education and professional referrals. 3. Train your staff to handle patient inquiries with empathy and professionalism, while always setting realistic expectations. In our next and final business module, Video E1, we'll bring it all together with real-world case studies of successful chelation programs and walk through practical examples of clinical and business implementation. I'm Adam Sewell, MD, and thank you for joining me in video D3 of the Medical Entrepreneur IV Chelation Training Series. I'll see you in the next video.